All right, today we're talking about building a gym, but not for your arms or your legs. We're building a gym for a set of muscles you use thousands of times a day, but probably never, ever think about training. Yep, the ones you use to breathe. Let's dive in.
You know that feeling, right? You're out for a run, maybe cycling, or just climbing a flight of stairs, and bam, you hit a wall. You just can't push any harder. Your legs are on fire, your heart's pounding out of your chest, and you're just gasping for air. We've all been there.
But here's a thought. What if that wall wasn't actually in your legs? What if it was in your lungs? Think about it. We spend so much time in the gym strengthening our arms, our legs, our core, but what if the real bottleneck, the thing that's truly holding you back, is the strength of the very muscles that pull air into your body?
So let's pull back the curtain on this unseen engine. It's funny, we take breathing for granted, but it's this incredibly powerful mechanical process. It's driven by a whole team of muscles that work nonstop, literally from your very first breath to your last.
And the undisputed star of that team? It's the diaphragm. Just look at this thing. It's this single dome-shaped muscle sitting right below your lungs. And get this, it generates up to 70% of your breathing power. It contracts to pull air in, relaxes to let it out. It's like a tireless piston just working for you all day, every single day.
Now, we all know our biceps get tired after lifting weights, right? But here's the kicker. Your diaphragm can get tired too. It can actually fatigue. And when it gets tired during really intense exercise, your body does something crazy. It starts stealing blood flow away from your legs to help out your breathing muscles. And that is what limits your performance. This is where our story really gets interesting.
Okay, so if they're muscles, that means we can train them, right? And the answer is a huge yes. But I'm not just talking about taking a few deep breaths. Nope. We're talking about real, targeted strength training. So how on earth do you do that?
Well, this is what the science calls respiratory muscle training, or RMT for short. And the keywords to remember here are systematic, structured, and progressive. Think about it. You wouldn't just walk into a gym and lift random weights, would you? Of course not. RMT is the same idea. It's a specific, proven protocol designed to make your breathing muscles way stronger and more efficient.
And it's not just about the diaphragm either. This targets the whole system. You've got your primary muscles for breathing in, those are the big players. Then you have the accessory muscles in your neck and chest that kick in when you're really working hard. And you've even got your expiratory muscles, we're talking your abs and intercostals, that help you push all that air out. It's a full body workout, really.
All right, so how do you actually take your lungs to the gym? It sounds complicated, but it's surprisingly straightforward. It all comes down to one of the most classic principles of strength training, resistance.
Basically, there are two main ways to go about this. First, you've got inspiratory muscle training, or IMT. The easiest way to think about this is like doing a bicep curl. For your diaphragm, you're breathing in against resistance. Then you've got the flip side, expiratory muscle training, or EMT. This is all about strengthening your core and your abs by breathing out against resistance. Put them together, and you've got a complete workout for your entire breathing system.
And yeah, just like any good gym workout, you need the right equipment. You can't just, breathe harder. RMT uses these really cool specialized devices that give you a specific, measurable amount of resistance. They're literally like little dumbbells for your diaphragm and your core.
So, what does one of these workouts actually look like? Well, it's surprisingly quick, but don't let that fool you. It's intense. Okay, so here's a typical session. First, you figure out your max pressure. That's basically the heaviest weight you can lift with a single breath. Then, you'll set the device to somewhere between 30 and 60% of that max. From there, you do about 30 controlled breaths. Take a quick rest, then repeat that for a couple more sets. You do this, say, 5 to 7 days a week, and, just like any good training plan, you slowly increase the resistance week after week as you get stronger. It's that simple.
Now, I know what you might be thinking. This sounds like something only an elite athlete would do. But honestly, the applications are so much broader than that. It literally spans from serious clinical rehabilitation all the way to pushing the limits of peak human performance. Just look at the range of people using this stuff. The biggest group, a full 40%, are patients with conditions like COPD and asthma, people for whom just breathing can be a daily struggle. But then you also have heart failure patients, people in surgical rehab, folks with neuromuscular conditions, and yeah, of course you've got athletes in there too, all looking for that competitive edge.
And the goal is totally different depending on who you are. For a patient, having stronger breathing muscles could mean less breathlessness, which is a massive improvement in quality of life. But for an athlete,
It could be the difference maker, the thing that lets them delay fatigue just long enough to push past their old limits.
And look, this isn't just some fringe theory. The benefits of RMT are really well documented in the science. So let's actually dig into the evidence and see what it shows.
The results are pretty amazing, and they're super specific. For COPD patients, it's been shown to measurably reduce that awful feeling of breathlessness. For people with heart failure, it can actually increase their capacity to exercise. For athletes, we're talking about delaying diaphragm fatigue, which directly leads to better performance. And in hospitals, for post-surgery patients, it can even help them get off a ventilator faster. These are real, tangible outcomes.
So how does all this happen? Well, the way your body adapts is pretty much exactly what you'd see in any other muscle you train. The muscle fibers in your diaphragm, they actually get bigger, that's called hypertrophy. The nerve signals that control those muscles get way more efficient, and all of this works together to reduce the overall cardiovascular stress on your body during exercise, which frees up blood and oxygen for your other muscles, like your legs.
So, let me leave you with this thought. Every single day, your breathing muscles perform something like 20,000 reps, just to keep you alive. They are, without a doubt, the ultimate endurance athletes of your body. So, the only question left is, isn't it about time you started training them?